Okay, I think we'll get started. Sammy, I'm looking over at you for a thumbs up. You can hear me, see the slide. Okay, great. My name is Becky Ofran. I'm the Manager of Engagement and Partnerships for the City Health Dashboard at NYU School of Medicine, Department of Population Health. Welcome. We're so glad you've joined today. These virtual office hours we do monthly. They're meant to be small, hands-on, interactive, informal, just a chance to get an overview of the dashboard. Sometimes we feature a partner or special metric or special project. And today we are featuring places from the CDC. So you'll get to hear about their measures and their work. And we'll also talk about how we incorporate those measures onto the City Health Dashboard. If you'd like to just put into the chat what city or organization that you're from, that helps us kind of know who is here. I'm joined today by Susan Carlson, an epidemiologist at the CDC, and another statistician on the project, Yan Wang. And I'm also joined by Sammy Breslin from the dashboard. Plus, I see a number of other dashboard team members on, so we'll definitely be able to cover any and all questions today. So we'll just do a brief intro of the dashboard, then Susan will cover the Places project and their measures of health, and then Sammy will show how the City Health Dashboard has incorporated the Places measures along with other metrics of health and equity that we have there. And then we'll try and leave most of the time for your questions and issues with either of the tools, specific measures, anything like that. So diving right in, as long as I can get my slides to change. Yep. So we created the dashboard with the ultimate purpose of helping mayors and city leaders improve the health of their citizens. And before we launched in 2018, most data on health and drivers of health were not organized at the city or neighborhood level, but rather at the county, state, or national level. And the City Health Dashboard changed that, and we now feature over 750 cities across the country, which includes all cities over 50,000 population. We have over 35 measures of health and well-being and equity, all to give that kind of all-in-one-place view of population health in really the city level. And you can use the dashboard for many different purposes. And in some of these virtual office hours, we kind of feature case studies. But, you know, really comparing and understanding those health gaps across neighborhoods. For example, this graphic is from the site is showing life expectancy in Columbus, Ohio. And you can see in those the blue neighborhoods there are census tracts where life expectancy varies quite a bit over a span of just 1 or 2 miles, those neighborhoods right next to each other. So, you know, that can be really important information to really ground the lived experience of residents in data that we can track. Because we pull from national data sets, you can really compare your measures across cities. It's everything that we have on the site is measured the same way across all 750 cities. And all of this data can really help you set priorities and better target resources. We have a number of criteria in choosing measures that we put on the site. So like I said, we try to pull from national data sets. We do a lot of rigorous statistical methods underlying that data collection. We really want the measures to reflect important public health priorities. We want them to be amenable to city level intervention. We update the data regularly, and they're balanced over 5 overarching domains shown here: health outcomes, physical environment, social and economic factors, health behaviors, and clinical care. And so you can get a glimpse of all the measures on the City Health Dashboard here, and you'll see that a number of them are from places. And that is what we will be kind of diving into today. We just updated these, any of the measures that are from places, we just updated them on the dashboard this month since they did their big updates recently. So I will turn it over here to Susan to share with us about the Places project, and then we'll take it from there. Welcome, Susan.
Thank you.
Looks good.
Excellent, thank you. Thank you so much for inviting us today to talk about our Exciting Places project. My name is Susan Carlson, and I am from CDC's Division of Population Health. And as you sort of just alluded to, we're from the Chronic Disease Center. So in December, we released Places. I have to say what it stands for at least once, although we don't usually use the whole acronym, and that's Population Level Analysis and Community Estimates. So this was released in December, and the exciting thing about Places, it's meant to cover the entire United States, including data for smaller cities and rural areas. So it's a big step forward for us, and we're very excited about our Places project. Today I'm going to talk for maybe 15 or 20 minutes, and I'll use about half of my time to provide an overview of Places, and then we will conclude with highlighting some tools that Places offers, and then we'll hopefully leave plenty of time for discussion. Let's see if I can get my slides to move. All right, there we go. So Places has a very collaborative history, and it's conducted actually through a partnership of CDC, the Robert Wood Johnson, and the CDC Foundation. So it's been producing sort of groundbreaking estimates since 2016, when 500 cities first published their estimates. And if, as many of you know, 500 cities was limited to the largest 500 cities and tract level estimates within those 500 cities. And then we've done yearly updates over time, and then finally in 2020, Places is released, and it expands coverage to the entire U.S. This includes almost all, it includes all counties, almost all places, almost all census tracts, and almost all ZICTAs, or zip code tabulation areas. So these are data that were previously unavailable. So why do we do Places? What's the purpose? So we think it's really important to have, and I think many of these, speak to our first couple slides of the session, and that is really about producing timely, high quality, small area epidemiologic data. So many of us, I'm sure on this call, know how hard it is to find these estimates for small areas. So that's why the Places project exists. So it's really about using these data to identify emerging health problems, to establish key health objectives, and to inform the development and implementation of effective and targeted prevention activities. In addition, the Places estimates really complement our existing tools. For many years, CDC has really been focusing on how do you get state level estimates. So the Places data is a great complement to our state level data tools, one of which is the Chronic Disease Indicator Project. If you haven't checked that out, I have provided the website here. And we'll talk a little bit about how the Places project relates to the Chronic Disease Indicator Project. And the other purpose of Places is, we've already alluded to, it extends previous efforts like 500 cities. It also extends the efforts by our partners. So one very important thing to CDC is our partners. So that's the County Health Rankings and Roadmaps is one of our partners, and our host for today, the City Health Dashboard. So we really think that this helps to promote not only CDC work, but a lot of the work of our partners. So I know many people are sort of worried, how does 500 cities and Places compare? Because I know a lot of users of 500 cities were a little bit concerned that it would be a big change, and that maybe they could no longer find the data that they're looking for, the data that they're used to getting. So in many ways, 500 cities and Places have a lot of commonalities. They both have the same 27 health measures. They both have these amazing data portals where you can download data in a bunch of different formats. You can get all the data you could possibly want. But then maybe for that more beginner user, they both have a pretty nice and extensive interactive maps where you can go and visualize your data. You can also look for estimates that maybe you're specifically interested in. And then now we start a little bit of the changes. They both have applications that allow for these comparison reports. However, the 500 cities is a compare cities report, while the Places currently only has the capability of a compare counties report. And that is something that we are looking at, is whether we could also allow for a compare places type of application, but we'll talk a little bit about the challenges of that in a couple of slides from now. And then the big obvious difference is, as we've already talked about, is 500 cities is limited to the largest 500 cities and census tracts within them, while places is the estimates for all of, or the entire United States. So what does that mean in terms of number? How many estimates does places actually provide? Well, here on this slide, you can see the magnitude of the number of estimates that places provides. There's over 3,000 counties, almost 30,000 places, over 70,000 census tracts, and over 30,000 zip code tabulation areas. In total, the entire places data set has over 4.7 million estimates for over 136,000 geographic units. So truly a monumentous task to bring all these estimates together in one place. So and then we talked a little bit about how do you select the health measures. So as I stated earlier, the health measures have stayed the same between 500 cities and places. But I'd like to just give a little historical look into how these measures were chosen. So these were selected based on their public health priority and because they have a substantial impact on people's health. These measures are risk behaviors that cause much of the illness, suffering, and early death related to chronic diseases, or they're conditions and diseases that are most common, costly, and preventable. So many of the measures in the places data set align with our work as part of the Chronic Disease Indicators Project. And again, going back to the importance of partnerships at CDC, is the Chronic Disease Indicator Project is a partnership between the National Association of Chronic Disease Directors and the Council of State and Territorial Epidemiologists and CDC. And the goal of that project was to identify key indicators for chronic disease prevention and health promotion. So when we started 500 cities and now places, we really use that information to develop and select our 27 measures. So one question we get is, how do I find out what the measure means? How is the measure defined? What is the rationale or the significance of that measure? So one of the things you can get from the Places website is probably a much more thorough measure description than you are probably even looking for, and that's a measure definition that includes all these things on this slide. It has the demographic group, it talks about the numerator and the denominator, it includes information on the background for that measure, what are the limitations of the indicator, what are possibly related recommendations that relate to that indicator, and then references. So here is an example of the measure for chronic obstructive pulmonary disease. And you can see all of the information that's provided. So really, I encourage you, if you're a big fan of an indicator or a specific measure, that you take the time to look on our website and see how that measure is defined. And our 27 health measures throughout our website are divided into sort of these three larger categories. There are unhealthy behaviors. We have 5 unhealthy behaviors. These include smoking, binge drinking, inactivity, and inadequate levels of sleep. There are 9 prevention practices. These include things like preventive services, like annual checkups and visits to the dentist. It also includes participation in important preventive services. And then finally, we have 13 health outcomes. These include specific health outcomes like arthritis or COPD, and also include some more general indicators of mental health and physical health. So lots of great measures as part of the Places data set. So now I'm going to talk a little bit about the method we use to obtain our estimates. We use a multi-level regression and post-stratification method. Sometimes we call this MRP. I'll try not to use that, but sometimes it does slip in. So our first step is really to create a multi-level logistic regression model for each measure. This uses data from the behavioral risk factor surveillance system. So the first part of the model, or listed here on your left, is individual level fixed effects. So these are from our survey, and they include sex, age, race, ethnicity, and education level. The multi-level part of our model is that we also have these area level fixed effects, and these help to capture some contextual information about where the person lives. And in our case, the area level fixed effect that we include is county level poverty. We also include 2 random effects, one for county and one for state. And these help to capture some of the contextual factors that are not explicitly measured in our model. So this is what our model is mainly made of, and that's our first step, and obviously a very big step. And the BRSS survey does include, over 400,000 respondents. So we have a lot of respondents that are included as part of this first step. Our second step is we apply the parameters from the model to the census population data to obtain the predicted probability for each measure. As next, we multiply the predicted probability with the population data over 208 categories by age, sex, and race ethnicity. Also a pretty big step, but here we're really using the population description of each of the units to get our estimates. For the estimates by place, census tract, and ZICTA, we use the 2010 decennial census. And for those by county, we use the 2018. And next, it's sort of, if that wasn't enough, we repeat this 1,000 times using a Monte Carlo simulation to estimate the mean and 95% confidence interval. So those are kind of a big, broad stroke of our methods. And of course, we'll be able to answer any questions you might have if you have more specific questions on our methods. So because we're using models with, as I said, over 400,000 respondents, our confidence intervals can be quite narrow. But how do we know our estimates are valid? So the best way is to compare the modeled estimates against survey estimates. These can be internally validated against BRSS direct estimates. So for example, there are a select number of counties that can produce a BRSS direct estimate. So we compare our model-based estimates versus those directly from BRSS. There's also a process known as external validation, where we compare with an external source. And here's a listing of some external sources that we've done some validation work with. So I'm not going to get too much into the method validation, but I do encourage you to check out our website, and there's plenty of references there. Most of our validation work has been done with our 500 cities estimates, and we'll hope to continue that type of work along with our places estimates. So I think it's important, as users of these data, that we understand what are the limitations of the methods. So as we talked about, these estimates are the statistically expected prevalence based on our models. Like any model-based estimates, our estimates tend to have narrow ranges and tend to underestimate those small areas with a high prevalence and overestimate areas with a low prevalence. So it's important to remember that these are not, we're not measuring for every small area. These are the model-based estimates. I think that's an important thing to remember. Second, our methods are not currently recommended for trend analysis. Right now, the places data is only for 1 year, but don't think about using it for trend analysis at this time. We are looking into possible options for thinking about that in the future. And perhaps most important, our models cannot detect effects due to local interventions. For this reason, used by themselves, these estimates should not be used for program or policy evaluation. And that's just something that I really want to highlight here, because we get that question a lot. I've done an on-the-ground, I've implemented an on-the-ground policy, or I've implemented an on-the-ground practice, and I would like to use the places estimates to see how well it's working. And again, because these are model-based estimates, they should not be used to do that type of evaluation. So what are the advantages of the method? Our approach has many advantages. It's very flexible. By combining both individual and area-specific information, we can really get small area estimates for population health outcomes. By modeling nationally and predicting locally, it can be used for just about any geography needed. So that flexibility is really a great addition to help small areas or small cities, towns, and even counties look at their data or get a feel for the estimates of health in their area. So now that you know a bit more about places, I would like to just end the overview section by stressing the public health applications. These data can be used to inform the development and implementation of prevention activities. They can help to identify emerging health problems and priority health risk behaviors. And they can really help those at the local level understand the geographic distribution or the expected geographic distribution of health-related issues. And finally, they're wonderful for establishing key health objectives that the community can focus on to improve health. So as in the next few slides, I'm going to talk about some of the places tools, and I'd like you to keep these uses in mind as we go through just a couple of tools. So what's available from the Places website, we've already talked about just a ton of information there, from measure definitions to information about methodology to FAQs, reference lists, and a lot of health documentation. For today, I'm just going to quickly talk about some of our applications, and then how do you get some of the data if you are a more advanced data user. So how do you access our interactive map? So our interactive map for Places can be accessed from our website. This is just a picture of how you would do that. That's on the front page of our website. You just click in to view the map. I'm not going to do a live demo today, but I'm going to just point out a couple of things. As we talked about at the top of the map, there are the categories that we talked about. So in this case, I've picked health outcomes. And then I've selected COPD. If you select prevention, you'll see the measures related to prevention. And then here you'll see a county level map for estimates of COPD. In this case, we've clicked on DeKalb County, Georgia, which is where our office is. And it tells us what the prevalence of COPD among adults in DeKalb County, Georgia is. It also provides a legend that shows you what the median prevalence is for the counties, and then it shows you the coloration. If you zoom in this case, I'm going to switch slides. If you zoom in, it can zoom down to the lower levels. In this case, if you see the layer that I have turned on, I have the ZICTA layer turned on, and our office is in ZICTA 30341. And here you can see that the estimated prevalence of COPD among adults is 4.8 for that ZICTA. And I know I do use COPD quite a lot in my examples. That's because that is one of the areas I work in. So I'm sorry for taking that license. Next, I'm going to just quickly show you the Compare Counties report application. For those of you that were users of 500 cities, you should really recognize this because it looks pretty much exactly the same, except now we have counties listed across the top. Here's a comparison of 3 large counties in the Atlanta area, DeKalb, Fulton, and Gwinnett. And here we're comparing arthritis across those 3 counties. So a lot of flexibility here. This can be exported as PDF, or you can also export it in an Excel version. So please go in and play with both of those and explore places and counties that you're interested in. Next, we're going to talk about the next 2 slides, or just how do you get the data. All Places estimates can be downloaded. Users can go to the Places data portal, which is accessible from the Places website. You can see that down here. You can go to the data portal, or if you know already which unit you're interested in, you can go to directly to the county, places, or census tract, sort of directly to those files. And here you can download all of the data. You can download it either in a GIS-friendly format or using an open data source. So lots of opportunities to download the data. In addition, at the data portal, you can filter the data before downloading. Perhaps you only want to download for a specific state. So there are all those options available as part of the data portal. Another option is if you are a user of GIS, there are 28 individual maps available in our gallery on the ArcGIS Living Atlas of the World. And many of the similar functions that we just talked about on the data portal are also available here with some additional ones. You can zoom to specific areas, you can filter data, you can use analysis tools, you can overlay with other data available from the Atlas, or you can overlay your own data. You know, if you are a GIS user, you can bring in your own data and personalize that. So I know that was a lot to cover, but I wanted to give everyone just a little taste. And I knew we would have sort of a varied audience, but this is a picture of our team in this virtual world. Sometimes it is nice to see people's pictures. So like I said, I'm Susan Carlson, and I also have Dr. Yen Wang with us, who is our awesome statistician. So I think if it's okay with everyone, I think we can move on to questions.
Great. We can take a few questions on places now, and then we can move on to how these places measures are incorporated onto the dashboard. I see one
Oh, that's
question.
right. We can skip this. Sorry, I jumped the gun.
That's okay. I see one question from Lloyd there. You kind of touched on that. Lloyd, do you want to ask anything else?
Not really. You pretty covered it. I guess I'm asking then, what is the sample size for the underlying BRFSS?
It's a little over 400,000.
Okay, thanks.
Yeah, good question, Lloyd. Sorry, I can't see the questions, but I think once I stop sharing, I think I can get in there.
Okay, if there's no other questions coming through on the chat, I will segue into a quick dashboard demo. But thank you so much, Susan, for just sharing all that overview, the detail. I mean, this is such an immense project and it's really so impressive. And I know I speak on behalf of the dashboard that we are so grateful to be able to access this data and provide this data onto our website for our users. And it really, it makes our tools so much stronger to be able to provide that, that picture of community health to the dashboard.
Well, thank you, Sammy, and thanks so much for inviting us.
Of course.
It's our pleasure.
Happy to, continue this partnership with CDC and places. I mean, the synergies are endless between these two groups. So thank you for joining us. So is everyone able to see my screen? Good, okay. You never know with WebEx these days. So I have just taken, I'm just showing the City Health Dashboard website. Becky touched on this in her intro, but we are a free online tool. Anyone with a internet connection is able to access the dashboard just by going to cityhealthdashboard.com. So if we just put in our city, I'm going to focus on Rocky Mount, North Carolina, which is one of our smaller cities that we added about a year ago to the dashboard, and is a city that has just gotten access to places data for the first time. And so you can see the same measures that Becky touched on earlier in her presentation, all listed out here. And most of the metrics that you see with this updated tag are actually from places. So all of our data is kind of in one place. We're a one-stop shop, and we integrate all of our data sets into one kind of cohesive, in one cohesive manner. So you can either, when you get to the dashboard and you know what you want to look at, feel free to obviously dig into any of these measures. But for today, I'm just going to show an overview very quickly, so you can see, a snapshot of all of the different measures that we provide on the dashboard. And you can see kind of at a glance, bird's eye view of where a city is, doing really well, and where are those challenge areas? Where are those areas that we can maybe, implement a program, implement a policy, and move the needle on health? I'm going to dig into diabetes today, one of the places metrics, and you can see here just this thumbnail of the map of Rocky Mount, some information about the metric, and I'm going to click into it. And one of the great things about the City Health Dashboard is that every single page on the site looks the same, no matter what metric you're looking at, what year of data, what city. The same kind of signposts, the same symbols appear across every page. So once you kind of have a handle on one, you have a handle on them all, which is really great, especially for our users who might not be as experienced at data or looking at maps and stuff. So here is the metric detail page for diabetes, and you can see, this scale bar here, which represents the range of values for that city. And across all of our metrics, lower values are represented by lighter colors, and better values are represented by lighter colors, whereas poorer outcomes are represented by darker colors. So for a metric like diabetes, you want less people in your city or your neighborhood to be experiencing diabetes. So, those lower numbers will have a lighter color, and you could see here, this blue check mark in a circle tells you what that direction of better outcomes are. This gold bar here is the city or the census tract value. So in Rocky Mount, 16.3% of its residents have reported of having diabetes, versus this blue triangle represents the dashboard city average. So versus 10.3% across the dashboard cities. And this green check mark here, which we do not see for Rocky Mount, is present when the city or the census tract value is better than the dashboard city average. And so scrolling down, you can see a map of Rocky Mount, and all of the census tracts in Rocky Mount are shaded based on their the estimates for diabetes. And what's great about the dashboard, and Becky again touched on this, is that it's really easy to see at a glance which neighborhoods are doing better and which neighborhoods need a little bit of help. And so, and those patterns are really, they resonate a lot with our users, and they make a really big impact very quickly for people who are looking at this data for the first time. And so it's clear here, you can see, better outcomes, lighter colors in this north part of the city, and the south part of the city is struggling a bit. And you're able to click into all of these these census tracts to get a little bit more information about what's going on, what the estimates are, what the tract is. So again, it just really drives those comparisons and helps you see, oh, this neighborhood is performing like this versus this neighborhood. What could be driving those differences? What do I know about these neighborhoods that could be related to diabetes? The dashboard also provides demographic detail for about 1/3 of our measures, not diabetes, but so you're able to see across the 5 major racial ethnic groups how each group is faring, especially compared to the dashboard city average, but also to the other racial ethnic groups. The dashboard also allows users to compare cities. A lot of times, we're not operating, a lot of these issues they don't exist in a vacuum, and we're not the only city that is dealing with diabetes. We're not the only city that is, working on a new program, working on a new policy. How can we maybe collaborate with other cities? Who else is dealing with these issues, or what other cities have a similar population size or similar demographics that have, implemented a successful policy? What can we learn from them? But sometimes those partners, those peers, we don't know who they are. We don't know how to kind of get them at our table. So the dashboard allows users to do that in a couple ways. You can either enter the city that you're interested in looking at, or you can filter by a whole host of different filter criteria: population size, location, racial ethnic breakdown, and I'll just pick population size here. You'll see 80 cities. That's a lot of cities. I'm not going to focus on a lot of the criteria today, but you can choose any of these cities that make sense to you, and that will pull down. If you just click onto them, it'll pull down that city's performance right here. So again, you would see Decatur has a similar diabetes rate. Can we learn from them? Are they doing anything? How can we collaborate potentially? And then compare metrics. One of my favorite dashboard features, diabetes is a very complicated issue, is tied up in a whole host of other things related to socioeconomic factors. A lot of other community factors go into diabetes, and it does not exist in a vacuum. And so we allow users to compare metrics to get a better sense of what's going on. What are the issues, the other issues that a community might be facing that might kind of be related to diabetes. So I'm going to look into children in poverty. And again, lighter colors indicate better outcomes, darker colors indicate poorer outcomes. And you can see here that, these same patterns that we saw earlier in southern Rocky Mount that is struggling with higher rates of diabetes, those residents also tend to be living in poverty. And how can, that context is so essential for when we're performing outreach or we're crafting a program or crafting a policy to really understand what these communities are facing and how different issues, how different challenges might move together across neighborhoods in a city. So the dashboard is really great for honing in on those those neighborhood characteristics. The dashboard also has a very comprehensive Take Action Center, which allows users to take that data to the next step, really move from data to action. Okay, so I've seen that diabetes is a big issue in the southern part of my city, in the southern part of Rocky Mount. Now what? What can I do to move the needle there? And so we provide over 300 different resources and tools to help you move the needle, whether it's programs and policies, who are the partners that we can invite to our table, how can we collaborate across sectors to make change there, how do we even perform outreach, how do we advocate for these challenges to our policymakers, and then funding, how can we not only access funding, but how can we apply for that funding? And then finally, measuring impact. Once we have a program or a policy in place, how can we know that what we're intending to do is what the community is actually feeling, is having that intended impact? And then finally, I do want to just bring your attention to the data access feature, which is one of the most powerful things about the dashboard, and is really great that we have places on here, is that all of our data is available for download in a few different ways, including the Places data set. So no matter, if you're an experienced user, we have CSV files that you can pull from this site, or we have the API, and you could really, this downloadable data makes it, easy for users to integrate with their own local data sets, perform different analyses, create data visualizations, and really bring the data to life in their own context. So that was a very quick demo of the site. Again, if you have any questions on that, happy to take questions about that, but I will open it up now just for some general Q&A, either for the dashboard project or for Places.
And we do have a question on here. Thank you, Sammy, and thank you, Susan. It's great to see the measures and how the tools kind of interface together. So a question about, I think it was referring to the dashboard. We rank cities to see who's doing best versus worse and where this city is. I'm interested in where it falls. So on the dashboard, we don't rank cities. There's a lot of factors at play, but if you download the data, like Sammy was just showing there at the end, you can rank and analyze and do everything that you want on individual measures, or look at things overall. And Susan, anything to say about ranking on the Places data tools?
Sure. We also don't rank. I mean, people can download the data and rank them, and that's actually what happens with the CDC state level data too, is we don't normally rank. As you're saying, there's a lot that's going on in there, and sometimes there is the margin of error also. So whether the first and the second, they can be a 0.1 apart. So really, we don't normally rank, but people can download the data and rank them. I think ranking can be, or putting people at least, or communities in order, can help if you're looking to identify areas that need maybe more focus, but otherwise it is can be challenging to rank based on these data.
So you can feel free to add questions into the chat, or just unmute. We're a little bit of a bigger group today than usual, but not so big that we can't and no questions from folks. So feel free to chime in if you have specific questions.
And Becky, we just got a question. This is for Susan. Does Places have plans to release at other geographies in the future, not just what you talked about earlier?
Great, and we'd always like feedback from users, and I would love it if Taylor would, if he or she feels comfortable. So what other geographies are you looking for?
So I work at the dashboard actually, and we've
Oh, that's okay.
yeah. So
No
we've
problem.
been we're thinking about a lot of different geographies that we could provide more data for, and some of the ones that have come up have been congressional districts or county subdivisions. I know are a big one. Just like anything that comes from the census boundaries, I'd be curious to hear about.
Yeah, so right now, we it is a lot. We have a lot of, over 130,000 geographic units. So it does become just a bit of just a management challenge. But there are also, we are thinking of offering some trainings or examples of, if you are interested in a geography that is not covered by Places but is an aggregate of those. So if it's an aggregate of census tract, how can you aggregate to get whatever geography you're interested in? But we are noting, we do have sort of a little Places inbox or a Places box where we get a lot of suggestions, and I think it really is just looking to see what other people want. But right now, congressional districts is not exactly on our list, but we certainly can note them, and also think about offering trainings that that could allow people to get estimates for areas that they're not interested in, as long as they're aggregates of the census tract. Congressional districts are certainly different, and we have done congressional districts for special runs, but I don't think it's something that is on our list currently, just because we are trying to think of sort of the local decision maker. That is our primary audience. And often the local decision maker, really their ability to look at a place and then the census tracts and the zip codes within it are really what that audience needs. But we could certainly think about other types of audiences and what geographies might they be interested in.
Happy to wait here for other questions.
Oh, I have a question for Susan.
Sure.
Yeah, could you tell me a little bit about the kind of geographic unit, the place? How does it differ from city and the bigger unit county?
Sure. So we use the census definition of place. So that's census defined. So there are those that are places which can be, incorporated cities, towns, counties, villages. It certainly does. And Sammy, you can jump into, because I'm sure you've gotten this question before, but it can also include those that are census designated places. So sometimes those are not necessarily, I wouldn't say as meaningful, but they can be combinations of places that are nearby. But we use the definition from census. So many of the places are, you know, what you would think of as cities, towns, counties, boroughs. I think some states have villages, so it's really an incorporated place. And then there are a number of them that are census designated places. So we stay with the census definition of places. So I think that, you know, I've never gone and checked, and I don't know if Yen knows, but I think all of the 500 cities, are they all designated by the census as a place? I'd have to look into that.
I think based on the dashboard correspondences, yes, they're all incorporated places.
Yeah, okay.
Yeah.
Sometimes they put sometimes they'll put two together. So that's why
Yeah,
I wasn't sure. But I think the harder ones are those that are census designated places. Sometimes those are a little bit harder to interpret because sometimes they have combined places that maybe on the ground don't see their relationship as much. Does that help?
Yeah, sure. Now it's clear. Thank you.
Sure.
Any other questions? Not, we'll hang out for another few minutes in case there's someone shy and just waiting for the group to get smaller, but which often happens. And just so folks know, so we do these virtual office hours monthly. As I said, each month we kind of focus on a different topic or partner or measure or issue. So Sammy, if you want to put the link to the page into the chat there, you can see some of the upcoming ones, and we add them regularly. So if you only see one or two for now, if you just check back, you'll see ones in the future added. And you can always reach us at info@cityhealthdashboard.com. That is not just a generic vacuum of an email address. It goes to Sammy. So she will respond to you. And Susan, if there's a good way to reach you, you can put that in the chat in case folks have follow-up questions. And we do record this, so we'll cut the beginning and ends and get it posted on that virtual office hours page as well, if you want to check back for any other information. And I think that's it. Susan or Sammy, anything else to wrap up?
I think that covers it. Thanks, Becky.
Great, thanks for joining. And again, we'll stay on just for a few moments in case anybody else has questions. Thanks. Okay. Thank you so much, Susan. It was,
Okay.
I've been through other 500 cities and places webinars, and I don't know, it was really helpful just to see the different steps of your modeling, and it might help that I'm taking a biostatistics class right now, so I have a new appreciation for regression modeling. But it's really great, all the work that you guys are doing. So thank you.
Well, thank you. I think, because I'm sort of relatively new here too, I think, sometimes when people have presented so many times, it's sort of, it's like, you're like, wait, I think I missed like page 1 through 20. So thank you. And thanks so much for inviting us. This is great. It's always good, and it's, always good to hear people's questions too, and it helps to give us other ideas.
Yeah, and I'm a little surprised we didn't have more questions, because when we don't have places on, we always get lots of questions.
I'm just gonna take that as I was so thorough that everybody.
I think so. So we'll let you know if anybody follows up, or if we otherwise just kind of get questions in our regular interaction. We'll touch base with you again, and we look forward to being in touch.
That sounds great. Thanks so much again for the invite.
All right.
Thank you, Susan.
Hope you guys
Take
stay
care.
healthy.
You too. Yeah, good luck today.
See ya.
Thank you. Thank you. Have a good
Bye.
night.
Bye.